Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Goodstein. He's a neonatologist at the WellSpan York Hospital and a member of the American Academy of Pediatrics Task Force on SIDS. Thank you so much for joining us.
Oh, it's a pleasure to be here today, Phoebe. Thank you for having me.
Today's Public Health Grand Round session was on sudden unexpected infant deaths, or SUIDs. Many people are familiar with the term SIDS, but not so much with SUIDs. What's the difference?
Right, that's a great question. It's really important for the public to be aware of this. So when we look at this, SUID has many spokes to its wheel. So there are some rare things like inborn errors of metabolism. There can be episodes where babies might die from getting too cold. But the majority of these deaths fall into three different categories under this umbrella of SUID. And one of them is SIDS. Another is accidental suffocations and strangulations in the bed. And another category is undetermined death. So people are familiar with SIDS, but it has a very specific definition to it. So when we talk about SIDS, we're talking about a baby in the first year of life that dies suddenly. It's unexpected. And then after you do a complete investigation, there's still no cause of death. So you have to do a full autopsy. You have to do a death scene investigation. You have to review the medical information about the baby. And if you do this investigation and then you still have no cause of death, that would be considered a SIDS. Now, it gets a little confusing sometimes for even us in the medical profession in terms of hearing about these undetermined deaths, because in a way a SIDS is an undetermined cause of death. But when we look at it from the point of view of the medical examiner or the coroner, they're kind of making a determination. These deaths are generally unobserved. They're happening during sleep time, so nobody sees what's happening. And there's some cases that may be very obvious. So if a baby is in their crib or their bassinet and it's a clean environment and they're on their back and they die unexpectedly and the autopsy doesn't show anything, that's a classic example of a SIDS. As opposed to a suffocation death where if a parent is sleeping on a couch and the baby is found wedged in the cushion and the parent woke up on top of the baby, that's pretty clear cut as well. But then there are some cases in the middle where the baby may be in an unsafe environment, but we're not sure if the environmental factors played a role in that death. And sometimes the coroner or medical examiner can't make the full determination of SIDS or suffocation, and then it remains an undetermined death.
Okay, so yeah, it is a little complicated, but I understand it better, yeah. So interestingly, we had some success in the 90s with reducing the SUID and SID deaths. Can you tell me a little bit about that?
Sure. I think this is one of the greatest public health success stories of the late 20th century. And the American Academy of Pediatrics lists it as one of the 7 top success stories in terms of pediatric care. So this is really a wonderful story. So back before the early 90s, we were having about 8,000 babies die of these kind of sleep-related deaths. And it was fairly consistent despite such things as using home monitors and other interventions. But what we started seeing as people reviewing data is that they were finding that babies were frequently found face down. There was often soft bedding around them. And one of the key research articles that came out was actually from New Zealand and Dr. Ed Mitchell, and they did the benefits of good death scene investigation. They were finding these lambskins and babies being face down almost always when they were dying of these unexpected deaths. And so when enough data came out in 1992, the American Academy of Pediatrics made a recommendation that babies should sleep on their backs, not their tummies. And then in 1994, with other partners joining in, including the CDC, we started the Back to Sleep campaign. And with that push to get people to keep babies on their back to sleep, we saw the rate of SIDS cut in half. Cut in half, which is absolutely amazing. So, there are tens of thousands of people walking around today because their parents got the message. A simple education message has saved so many lives, putting babies on their back to sleep. So in the 90s, we had this great success. And then what happened was, after the 2000s, is that the rate of SIDS kept kind of dropping down more. But when we looked at the overall number of these sleep deaths, they stayed flat. These SUID deaths kind of flattened out because what happened was we started seeing a rise in these deaths from suffocation strangulation, which Dr. Shapiro-Mendoza had some great research on, showed a quadrupling of that through the 90s and early 2000s. And other data that came out of the CDC showed another increase of 30% from 2000 to 2010. So people talk about what we call this diagnostic coding shift. So we're giving a different name to the deaths, but the total number of deaths have really kind of flattened out. I think what we'll find is if we could have more people putting their babies on back to sleep, that these numbers could really drop even further than where we've kind of stagnated at today.
Yeah. What are the other recommendations that they make for safe sleep?
Sure, yeah. The American Academy of Pediatrics has, unfortunately, it's a little bit of a long list, but if we focus in on just the ones that are really important for families to know about in terms of sleep environment, we want to have an uncluttered sleep space. So the baby should have a Consumer Product Safety Commission approved device, whether it's a crib or a play yard or a bassinet. We want them to have the baby close to them in the room to promote breastfeeding, and breastfeeding is a great way to reduce the risk of SIDS. And we want a smoke-free environment, and then we want really the baby and mom close together in the same room, but not to be sharing the bed, because we know that there's a risk involved with that. So we want no bumper pads in the baby sleep area, no extra blankets, no soft bedding, no stuffed animals. Really, it should just be the baby, a firm mattress that fits tightly in the crib, and a firm fitting sheet. And people need to know that if it fits across but it's still soft, that's not okay. We want really a firm mattress and then something that's tight fitting on there, so there's nothing loose that can get around the baby's nose or mouth that can create a suffocation risk or increase the risk of SIDS.
So SIDS. What else can healthcare providers do to reduce these deaths?
Yeah, there's a lot of good things we can do. I mean, we've been doing a lot of education of providers, but I think we need to keep doing that. I think we need to have more consistent education. So it's important that hospitals have safe sleep policies that follow the AAP guidelines and recommendations, so that one provider isn't talking about certain things with safe sleep and another provider is saying it's okay to do something else. We need to model things properly, because it doesn't matter what we say. Parents look at what we do. So what we say is important too. So I can tell you that if we don't have the conversation, parents may do just what they've heard from other people. But I can tell you from data, Dr. Colson, who spoke today, she's shown data that that only about a third of doctors talk about back to sleep with new mothers. But if they do, those mothers are 3 times as likely to keep their babies on the back. And if we talk about not sharing the bed, then parents are much less likely to do that. So it's definitely the conversation is important, but it's also how we model it. So we know that if nurses consistently keep babies on their back in the nursery, parents are up to twice as likely to also do the same thing at home. And if we tell them to put the baby on the back, but then somebody brings the baby out on the side or face down, they're going to see that and think, well, if the nurse does it, that's okay to do, so that's what I'm going to do at home. So we have to be really, really consistent with our messaging. And that messaging really should be over a continuum of time. So we should be getting this message out prenatally. It's a really important message for obstetricians. Make sure moms aren't smoking while they're pregnant, because people focus in on secondhand smoke after the baby is born. But if mothers don't smoke during their pregnancy, we could probably eliminate a third of SIDS cases right off the bat there. And then it's really important for pediatricians and family doctors and other practitioners to kind of give people an attaboy and tell them they're doing a good job, because when you get to that peak period of time for SIDS between 1 and 4 months, that's when parents are really feeling the grind. Being a parent's a really hard job. It's the greatest job in the world. It's the hardest job in the world. You're going to be sleep deprived. When you get sleep deprived, sometimes your decision making isn't as good. So we really want to reinforce that message that, hey, if you're doing safe sleep recommendations, you're doing a great job. And even if it means a few days where you're not getting enough sleep and you're feeling tired, that's better than having a lifetime of having remorse that something bad happened because we put the baby in an unsafe sleep environment.
Yeah. If people want to know more about this, where would they go?
That's a great question. There's lots of places that you can find information on the internet, but you have to be really careful. Dr. Moon did a study that showed that many of the places on the internet have inaccurate information about safe sleep. So it's really important that you go to trusted resources. So one of the best places through the Unischreiber NICHD website, if you just type in safe to sleep, it'll take you right to their website, and they have all the best and up-to-date information, and even question and answers about common misperceptions and questions that people have. You can also go to the AAP's website, healthychildren.org, and that's a website that's designed specifically for parents. And then there are a bunch of different SIDS prevention groups that have really good information, such as cribsforkids.org and First Candle, and places like that have very good information as well. The Charlie's Kids Foundation, Dr. Hankey's foundation, you'll always get great information there as well.
Okay, and the Cribs for Kids, you're involved with that too?
Yes, yes. I run our local chapter of that. It's a wonderful program that really promotes education for all families, but for those families in need, they can get a play yard or pack and play, or what they've developed their own brand called a Cribette, and there's really no financial testing for that. If we identify a family that's in need, we want to make sure before they go home from the hospital, even before they have their baby, that they have a safe place for their baby to sleep. And they also provide other things such as the sheets, and you can get a wearable blanket or sleep sack. So all these things that are important for promoting safe sleep are available through this organization.
Oh, that sounds like it's very lovely and helpful.
Yeah, they're in pretty much in every state of the country, and they continue to expand. I think they have somewhere between 800 and 1,000 chapters now across the country.
Yeah, wow. Thank you so much for joining us.
Oh, it's been such a pleasure to chat with you. Thank you.
Thank you. And thank you for joining us. See you next time on Beyond the Data.